So the role of medication or any kinds of giving anything, what we call a soporific, anything to induce sleepiness, really, it's really the last resort. You want to try and manage it in any other way. And again, it becomes situation dependent. For example, if we go back to the case of the child with Smith's beginner syndrome who's producing melatonin at the wrong times, well, they may just need melatonin at night. Um, many kids that are neurodiverse have mood dysregulation. They get sensorially overwhelmed. They have overwhelming anxiety and end up on medications. So one's got to look at, well, what's the effect of the medications that they're taking in the daytime on their sleep? And one may have to kind of look into that and see what needs to be adjusted. But when it comes to actual medications for inducing sleep or maintaining sleep, it really breaks down into those two categories. Is your child having difficulty just falling asleep? And once they're asleep, they sleep through the night. Well, that's awesome, because then we can just locate something that is short acting, that doesn't last the whole night, that can just get them to sleep. And in that context, melatonin can be very effective. Melatonin only works for 3 to 4 hours. It gets cleared out of the body very quickly, and may just do the trick. Now, it's not, it doesn't work for everybody, but it's considered, as far as we understand, relatively safe within the context of a child who's taking 3-4 hours a night to fall asleep versus, hey, if we give them melatonin and they fall asleep within an hour or half an hour, the benefit of them getting those extra hours of sleep versus the disadvantage of being on melatonin or the effects of melatonin, you've got to weigh that up as well. Now, we don't really know what the long-term effects are of melatonin, but it is used very, very widely. And if one looks at the research overall, it's considered to be safe. Now, if you read the research for the use of melatonin in individuals with autism, it is the first line recommended agent. And they don't recommend exceeding 10 milligrams. Generally speaking, the lower the dose, the better. So if you can get by with a low dose, that's the way to go. I adopt a kind of stepwise approach. If we're still looking at trying to induce sleep, and that's where our focus is, then we move on to prescription products that don't work for very long, just to get the child to fall asleep. And there's various products. There's the medications like clonidine is pretty useful for helping you fall asleep. And then there's a whole series of meds that, if you have difficulties maintaining sleep, there's a whole series of medications that most of us that work in this field will pursue in a stepwise manner. I do have some incredibly challenging cases where they're on multiple medications for sleeping. A combination of meds that help them fall asleep and a combination of meds that will help them stay asleep as well. So again, it's you've got to kind of weigh up the pros, the benefits versus the risks. And when kids don't sleep well, they don't behave well, and families don't behave well. So one's got to take that into consideration.